Thanks for staying with us. Right now, still on cholera, we have the WHO, that's the World Health Organization, announced an increase in cholera cases in several regions. Right now, we'll be having on the phone with us the DG of the Nigeria Center for Disease Control, NCDC, Dr. Jide Idris, who will be giving us an update on the state of cholera in the nation. Good morning, sir. Are you there?
Yes, I'm here. Good morning to you all.
So we heard of the outbreak. Lagos, as of yesterday, was about 500 confirmed cases and about 29 deaths or so. What's the situation right now nationwide?
Well, nationwide, as at yesterday, we had 1,528 cases, 53 deaths across the 31 states and 107 local government areas. However, the case fatality rate was about 3.5%, which is much higher than what is agreed for this area globally. So that's a cause for concern for us.
What's happening around the enforcement, sir? Because, correct me if I'm wrong, they said this started with a bottle of Tiger Nut drink, you know, the unbranded bottle. So sir?
Yeah, go on.
So what are you doing as a body, you know, to sensitize Nigerians about such bottles or drinks?
Well, let me say again that that Tiger Nut drink is just one source, because that itself was used contaminated water to make it. So it could have contaminated other sources, but that's one source. And that basically, the idea is to let people know what cholera is, how it presents, and how it can be avoided. Cholera is a disease of poor access to or lack of access to water, sanitation, and hygiene. It is caused by an organism that gets into our food or water. Once the food or water is contaminated, it is transmitted. And it presents typically with serious diarrhea, profuse diarrhea, the color of which is described basically as rice water stew. That's characteristic. It could come with vomiting or not, or fever. However, the most serious aspect of it is that once you start having diarrhea, you must seek medical attention because the diarrhea is profuse. You lose a lot of fluids and electrolytes, and that's what kills. But once you can get to a health facility, they will rehydrate you and get you back to what normal. Every other thing can be taken care of. So the message is, once you start having this diarrhea, visit the nearest healthcare facility. But again, as a preventive measure, try to boil your water before drinking, or using it to cook.
It's sustainable. There's no gas.
Pardon?
Yeah, I'm saying is, you heard my thoughts. I was thinking out loud. I said, is this sustainable? There's no gas. We're managing everything at the moment. But I wanted to ask you, how is the sensitization going so far? Are people responding?
Sensitization is going quite well because I heard responses last night when I was at 2 TV stations, responses from different people on the streets. They know what to do, and it's going on at different states because it's a state issue. All this is occurring in different states. We've sent out advices to them. We told them what to address, and they will address such in the languages that are peculiar to their states. But I'm happy that all the states are taking over their responsibilities. They are holding meetings, doing surveillance activities, and trying to address the people in terms of prevention. So I don't have any doubt whatsoever that we will overcome. Yesterday, we established the incident and national incident command systems. Basically, this is just a way to coordinate nationally the response to this cholera, so that we don't have this scattered response. We also consolidate the issue of resources we have so that we can distribute to the various states that need them. This time around, we're concentrating on the hotspots, about 8 to 9 states where this disease is very, very rampant. They constitute about 90% of the cases nationally now, so we're concentrating on them.
Okay, let's talk about the issue of vaccine, because many of the states are saying that they are yet to receive vaccines from the federal government. The SA2, the governor came on our show of Lagos State was saying that there was somewhat of decline in Lagos, but right now it looks like over the weekend the numbers went up. So what's the update on that, on the issue of the updates in Lagos, and then the issue of vaccines?
The update in Lagos, what we have here is on the rise, because they have more deaths now. But I hope, since they've all gotten together, they've got their acts together, we hope to see a decrease in number of cases in the next couple of days. With respect to the vaccines, let me say that vaccines alone cannot control any disease. That's number one. Number two, it's not peculiar to cholera alone. Vaccines generally, the demand for vaccines generally, nationally and globally, the demand is so high. The demand is high. Supply is very limited. Most of these countries pre-order for these vaccines when they know that this is occurring. And so I know that the Minister for Health has contacted Gavi and CGI for more vaccines. I don't know when those vaccines arrive. But more importantly, the vaccine itself only gives limited immunity for a short period of time. So generally, we say that you use vaccines in combination with other control measures, preventive measures, and address issue of water, address issue of sanitation, and personal hygiene. With those three, we are sure that you can contain the disease.
Okay. All right. So what are the plans? I mean, we know some of what Lagos State is doing, but there are some places, other states. How are the numbers in the other states doing? Are you experiencing a decline in some states, or is there still an increase across the various states that we have?
With the encouragement and all the states that have been sensitized to take up the battle in their various states, they've set up their own incident command systems. We've also sent out rapid teams from here. I know that I was in Lagos last week. Two of my colleagues are in Lagos right now, helping them, assessing them. We've sent other teams again to all those hotspot states to guide them and support them. Also, our partners like WHO, UNICEF, etc., they're also in various states to support all the states, especially where there are gaps.
Okay.
I don't have any fears whatsoever that in the coming days we will to get over this.
Aside, what other measures means do people contact cholera aside, contaminated water? What should we be doing as a preventive measure? Washing hands?
The prevention, hand washing is basic, and that's what we are concentrating on. And I think this culture of hand washing should also be passed on to our school children. So the school health program must be activated in various states. That's that age where issue of hygiene and personal hygiene ability can be cultivated early. Apart from hand washing, this open defecation we should discourage. Like Riley said earlier on, you don't have water. So what we are talking about, linking up with the Ministry of Water Resources, is that at least they should try to provide temporary water supply, maybe tankers with good water to those areas where they don't have water they can assist. You provide mobile toilets or build portable latrines that can be properly maintained for now, at least because I know defecation is a physiological reaction. If you have nowhere to do this, you do it openly. So we need to discourage that. Secondly, with the rainy season, NIMET has predicted a heavier rainfall this time, and we need to be careful, especially all those flood-prone areas. Once the flood starts, there's a tendency that the source of water there can be contaminated. So they need to do something about this flood, either move people away from the flood-prone areas and do something. But this is a long-term measure, and this is where, again, physical planning is essential. It's a long-term measure, but most states should address this one. So most states should address the issue of water supply, environmental sanitation, waste disposal, sewage disposal, drainage systems to reduce the flooding, effect of flood, and of course, continue sensitization. If they have access to vaccines, when the thing comes, the National Primary Healthcare Development Agency is the one that handles vaccines. They know how they will distribute this to the people who most need them.
This question is for people right now, because while we are waiting for government to supply water and everything, there has to be a way for people to sterilize their water right now. I listened to a doctor yesterday saying if you put your water in the sun and the sun beats it, maybe put it on the roof of your car or something, that sterilizes the water. Is that possible?
That is not possible because if you want to sterilize water, you have to boil it. The sun cannot boil water.
Yes,
I know that some materials have been sent to the various state governments now, even with support from WHO. They are providing disinfecting tablets for people to use in their water, just to reduce the number of bacteria there, to decontaminate the water before they drink or use them. This is being circulated, being propagated at the local government and the state governments. We also distribute again from here when we get when the supplies are. No, we will send some out to the various states now. So these include oral radiation therapy, chlorine tablets for disinfection of water, IV drips, etc. These are things they will need on the field to address this. We also, for states, perhaps again, they should create oral radiation centers for those of them who have diarrhea, where they can easily set drips for them, give them the fluids, and give them other treatment they can use. And we're having assistance by MSF on this matter because that's their area of expertise.
Okay. Thank you so much, sir. I mean, is there any other updates you think we should know before you leave? Because so far, we're happy that the government seems to be putting this under control, but we're just worried about a serious spike in certain areas that don't have quick access to medical care.
No, that's why we've sensitized all states now. All states are on alert for this. And we are, the incident command system now, we have people all over the states now who collect data, who track the data to see the occurrence of this disease. And with that tracking, we can narrow down to which areas they have problems and address those problems there. We give them all the necessary support. We're also currently training staff in various state governments on how to make diagnosis. You don't wait for all these highfalutin diagnostic facilities. Cholera presents in a very typical manner, and it's something, again, you can use microscopy for. Just look at the stool and put it under the microscope. You can make your presumptive diagnosis.
All right. Thank you so much, sir. We'll be speaking with Dr. Idris, Dr. Jide Idris, the DG of NCDC. Thank you so much, sir, for joining us this morning. That's all we can take on today's show. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.